Hi there, I am Dr. Muhammad Radif Dawood, working at Nasal University College of Medicine, Otolaryngology Department, Baghdad, Iraq. My article title, Epidemiological Analysis of the Nasal Trauma, published in the International Journal of Science and Research. First, now we go to the introduction. The nasal is a central structure of the facial midline that fulfills the functional and the aesthetic purposes of the nose. The nasal bone or the nose is formed by union of rigid nasal bone structure and flexible cartilaginous structures. As the nose is the most prominent facial feature, it carries an increased risk of traumatic injury. And since the bones are the most fragile of the nasal external facial bones, it has the least amount of tolerance to the impact forces. While children's noses are mostly cartilaginous, and so it possesses a fractured nasal bone as a green stick fracture. The key issues to consider when examining the patient with nasal trauma include nasal deviation, depression, step deformity, and mobility crepitus, special area of bone tenderness, and generalized swelling, subtle hematoma, and laceration. So physical examination had been considered as the reference standard for nasal bone fracture diagnosis, while radiographic diagnosis of the nasal bone fracture may be controversial, as an old fractures of the nose frequently healed by fibrous union. So nasal fractures are commonly reported due to many etiologies or various etiologies, as assault, contact sport, adventures are common. Also, motor vehicle crashes and interpersonal violence are the main causes, while alcohol consumption is considered as a contributing factor. So the objective of this article is to evaluate the relation between the mechanism of nasal trauma with the age, gender, occupation, residency, and the nasal bone fractures among Iraqi patients. So patient and method. This is a descriptive study enrolled 124 patients attended ENT occupation department complaining of recent nasal trauma, i.e. within 2 days, in whom all information were collected, including age, gender, occupation, and residency. Mechanism of trauma and topography of external nasal skeleton were collected, and their correlation was evaluated and studied. All patients were subjected to full ENT examination with special attention to the nose. The result: among 124 patients with nasal trauma, there were 76 patients are males and 48 patients are females, with the mean age of 27.4 years. Go now to the table 1, which reveals or shows the type of nasal trauma among patient sample regarding the age group and gender. So, in age group less than 10 years, in the male and female, the most common cause of nasal trauma are fall. In the age between 11 and 20 years, the main cause of nasal trauma in the male are personal assault, and in the female, accident apart from the fall. While in the age between 21 to 30 years, the main cause of nasal trauma in the male are personal assault, and in the female also accident apart from the fall. While in the age between 31 to 40 years, the main cause of trauma, the same in the male, are personal assault, and in the female are accidents apart from the fall. Regarding the nasal bone fracture, among these 124 traumatized patients, only 102 patients had fractured nasal trauma, i.e. about 82%. Now in the table 2, show the distribution of nasal bone fracture with a nasal pyramid deformity. No deformity was in 4 patients. These are children which had green stick fractures. Center depression in 36 patients and sided deviation in 62 patients. Now, the relation between nasal topography distribution between the patient samples are shown in the table 3. In the age group between less than 10 years, in the male, no deformity, and in the female, also the most common are nasal, no deformity. But in the age group between 11 to 20 years, in the male and in the female, the most common topographic deformity are sided deviation. While in the age between 200 to 30 years and 31 to 40 years, the most common cause of the male are sided, the most common deformity of nasal deformity, the nasal pyramid in the male are sided deviated, and in the female are central depressed, while in the age between 31 to 40 years, both are sided deviated, are the most common nasal deformity. Table 4 shows the relationship between the mechanism of nasal trauma and topography of nasal pyramid. No deformity found in the fall cause, center depression most commonly found in the personal assault, as well as sided deviation mostly caused by personal assault. The result of relation of nasal trauma to the occupation, the most common finding found in students, followed by employee. While regarding the residency situation is most common found in urban area than in rural area, and only 2 children with subtle hematoma found as regarding the complication of nasal trauma. Now we go to the section of discussion. The etiology of nasal trauma, as we said, is heterogeneous, and prevalence of its mechanism factor in relation to certain parameters as the age, gender, nasal pyramid topography, occupation, and residence classification were studied and analyzed. The current study report a higher incidence of nasal trauma was found in male than in female, and these results are comparable to other studies. The reason of higher incidence in men probably because usually they are involved in hard physical jobs as well as they are involved in outside door activities. The most common age group in this current study was found between the age of 21 to 30 years, and these results are almost similar to other studies, while only in Lutfi et al. Study found the most common age group was 10 years to 21 years. 10 years to 21 years were the most commonly affected. The reason for higher frequency of nasal trauma in this age group, i.e. between 21 to 30 years in our study, that it may be due to the physical and psychological behavior of these young adults as well as its most active population. In this current study, the personal assault was the most common cause, and it was comparable to other studies, while some studies found that the fall was the most common frequent cause. The variability in the frequency of the cause of nasal trauma depends upon the location in which the study has been performed, and also perhaps due to cultural level, different lifestyle, and specific community characteristics. Among all traumatized patients, only 82% has had fractured nose, where side deviated nasal pyramids are more common than central depression, and these results comparable to other studies. These findings usually was related to the direction of the force and to the type of the nasal trauma. Regarding the occupation, the result revealed was most commonly found in students, and the result of other studies said by Lutfi, done by Lutfi et al. Found is most commonly seen in school pupils. This result was probably dependent upon the social class that play an important role in the etiology of nasal trauma, and then on society characteristics and its cultural levels. About the residency classification, the study found it's more common in urban than rural area. Is comparable to Lutfi study. The reason for that is probably that the higher number of population in this urban area, which result in a lot of people interactions and the socio-economic or educational level differences. Conclusions. The high frequency of nasal trauma was detected in a male age group between 21 to 30 years, students, urban residency, and the person assault was the most common or the most frequent etiological factor. The frequency of nasal bone fractures was almost high. The frequency of nasal bone fracture in the nasal trauma was almost high, 82%, and it's being side deviated more than central depression. Recommendations. The current study will make a step for public health measure to make the programs for preventing or at least decreasing the frequency of the nasal bone trauma by instructing the people to increasing their cultural level, improving their interpersonal behavioral relationships, as well as to improving the safety procedure, especially in crowded public places. Also instructing the people to obey the traffic rule and safety driving, and then also at the end improving the family care interaction and to construction of safe places to play sports. These are some of the references. These are the references of this article. And thank you.